On October 13th, the Senate Health, Education, Labor, and Pensions Committee released a report highlighting the discrepancies between nonprofit hospital systems' CEO compensation and their commitment to charity care. They give suggestions on how to strengthen nonprofit requirements to make hospitals do better. In fact, in the report they write, nonprofit hospitals are given tax-exempt status so they can serve the public good, not price gouge patients in dire need of health care. There was some pushback to the report. The American Hospital Association says the report ignores some of the community benefits other than charity care, but the Senate committee also takes issue with what that broader definition of community benefit actually includes. Here's a little background. The Affordable Care Act actually requires nonprofit hospitals to develop and publish financial assistance policies. These policies then allow patients under certain income thresholds to apply for free or discounted care. Federal law doesn't actually set minimum standards for the policies, but some states have stepped in and set some standards themselves. Nonprofit hospitals can't take extraordinary collections actions against patients without first making some effort to determine their eligibility for charity care. In the report, they reviewed the charity care given out by 16 major nonprofit hospital systems in 2021. They found 6 of the biggest systems dedicated less than 1% of their total revenue to charity care. In fact, 12 of the 16 studied dedicated less than 2% of their total revenue to charity care. Nonprofit hospitals' profit and cash reserve increased significantly between 2012 and 2019, but the report says charity care dropped slightly in that same time period. And as we said, they did look at those hospitals' CEO compensation as well. And they said the CEO average pay was about $8 million. More than half of the 16 hospitals paid CEOs over 6% of what they spent on charity care. In the report, they pointed to some of the worst discrepancies between CEO pay and charity care. One system spent $32 million on their CEOs while only dedicating 1.5% of revenue to charity care. In another example, $10.9 million went to CEOs while only 0.7% of revenue went to charity care. The report did have recommendations. Congress should ensure that hospitals are offering charity care at levels consistent with their tax breaks. They said establish clear, enforceable standards for financial assistance policies. They said make hospitals provide assistance without need for patients to affirmatively apply for financial assistance, respond to specific needs of the community, report community benefits provided at each hospital rather than system-wide, and there are more recommendations in the report as well. Outside of the report, some of the senators commented, if the hospital analyzed in the Senate report don't substantially increase charity care, they should lose their tax-exempt status. You can read that report. We link to it in the description below.